March is Brain Health Awareness Month. It's meant to shed light on harmful and healthy habits, plus ways to protect your brain. More and more, these conversations involve discussion about time spent online or screen exposure. In a letter published in Nature Human Behavior, researchers are now calling attention to the risks of information overload. It's something they compare to environmental pollution for your brain. For more detail on this, CBC Health columnist Dr. Melissa Lem joins us from Toronto. So Dr. Lem, thank you. How does information overload impact our brain health, and what steps should people take to minimize that harm?
Tanya, the truth is that our brain only has a finite capacity to direct its attention, and our modern world of unending articles and viral videos fills that attention bucket up to the brim until it's overflowing, which causes fatigue, irritability, and trouble focusing. And this can leave our brains paralyzed, whether it's with decision-making or evaluating new information. And combine that with the fact that over 80% of us live in cities, which are filled with other distracting traffic, noise, and crowds, and you've got a recipe for less than optimal brain function. Some things that we can do, though, to minimize those harms are using apps that measure and limit our online time, turning off all those intrusive notifications, and heading outside for at least 2 hours per week, because there's a lot of research showing that time in nature restores our brain's capacity for attention.
Yeah, certainly sometimes that stimulation or overstimulation is subconscious. We don't even realize it. How do you differentiate between brain health and mental health, and how do those two intersect?
Well, the difference between the two is that brain health refers to the overall structure and function of your brain, which includes things like how good its blood flow is, how healthy the connections are between different parts of your brain, and memory and information processing. Whereas mental health focuses on your psychological and emotional well-being, so your feelings, your moods, and behaviors. But the truth is that brain health and mental health are almost inseparable. About 1/3 of stroke survivors develop depression, and elders with anxiety raise their risk of developing dementia by over 50%. Sometimes people forget that our brain is an organ, just like our heart or our lungs, and it can get sick too. Taking care of our mental health means taking care of our brain health, and vice versa.
Now, concussions are the most common type of brain injury. Why is education around post-concussive symptoms so critical?
Well, just like if you sprained your ankle, when your brain gets injured, it needs rest and support to recover. And that means avoiding screen time and tasks that demand a lot of focus and concentration, and getting enough sleep. If we don't educate people about this, unfortunately, those symptoms of headache and dizziness and brain fog are going to be more severe and last longer and cause more disability.
You mentioned sleep, illness and injury aside. We know that sleep is important for general brain health, but how does it actually keep our brain healthy, and what happens when we don't get enough sleep?
Tanya, lots of important processes that support your brain health happen during sleep. For example, parts of the brain get regenerated so it can function normally the next day. Toxins that build up when you're awake get removed. You could say sleep is like a garbage disposal for your brain. If you don't get enough sleep, though, the damage and the toxins build up, which can worsen your mood, your memory, and your focus and creativity. And unfortunately, your body is also affected. Your risk of diabetes, cancer, and obesity go up, and your immune function drops. And that's why it's so important for people at every age to prioritize good sleep as a pillar of health, just like healthy diet and exercise.
No doubt. Well, as always, thank you so much for your expertise today.
Thanks, Tanya.
That's CBC Health columnist Dr. Melissa Lem joining us.